And it appears our pets aren't immune to the coronavirus. A few have tested positive for it. So in this week's Ask the Doctor segment, we figured we'd get some insight on protecting our furry little friends. Joining me now is Dr. Robert Tiballi from the Catholic Medical Association. So Dr. Tiballi, what about our pets? How can we keep them safe?
Well, it appears that pets may get the coronavirus from intense exposure from their owners, not really so much pet to pet. So if your dog is in a doggy daycare kind of situation or gets group walked, it's unlikely the dog is going to get it from other dogs, but they could get it from their owner. It doesn't seem to be significantly harmful to dogs or cats, both of which have tested positive, and they seem to have the virus for some period of time. It's unclear how long they will suffer from it, but we don't understand or recognize that people can get infected from their pets.
Okay. Now, we've spoken before about hydroxychloroquine. You've said you've prescribed it before. A new study says it doesn't help COVID-19 patients here in New York City, given the possible dangerous side effects of the drug. Do you think hydroxychloroquine should be used to treat the virus?
Well, I only know what I see. That's called anecdotal evidence, and it's not in a study platform. But I continue to prescribe it. There's very few options, and we have seen significant changes in patients with the hydroxychloroquine. So it's important, the proper dose and so on. But if there's a better medicine comes down the line, I'll use it. But for now, I continue to use hydroxychloroquine and watch the patients closely.
All right, and now a lot of people are getting the antibody test. Even President Trump said he'd get it. But the CDC says even if you have the antibodies, it doesn't necessarily mean you're immune to the virus. What's your take on that?
Well, it's possible that antibodies might not be protective. It'll be very helpful when we have these studies of people donating their plasma and seeing if that helps patients who are very sick get over the virus. But there's lots of other similar RNA-type infections, one notably hepatitis C and other Lyme disease, where antibodies are not protective. People develop antibodies when they have the illness, but they don't help get a person over the illness.
All right, last question. Researchers in Arizona discovered a new mutation of the coronavirus, which suggests it might be weakening. Is that possible?
Well, lots of times viruses, as they extend their course through humanity, they do spontaneously change. Oftentimes, that causes them to weaken. Sometimes they can strengthen through mutations. We always want the virus to weaken, and that's something that we should really hope for. The Spanish flu in its second wave became a little stronger, more pathogenic, causing more severe illness in young people, the second wave. But we would hope that this coronavirus would continue to weaken and peter out over time.
All right, Dr. Robert Tiballi from the Catholic Medical Association, thanks for joining us.
Thank you very much.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.